Camera action. Hello, everyone. My name is Busayo. You can also call me Dr. B. Yes, I knew I've asked you guys to send me questions. I've got those questions here. One thing about me is I'm a bit shy, and there are some words that I never imagined using on social media. But look at us now. We're here. The first question has to do with vagina. That word, as much as I use it with my patients, it's sort of heavy for mouth for me to just start talking about it on social media. But, anyways, our first person says, "Hello, please, I'm having vaginal pain when laying down at midnight." Thank you very much for that question. As much as pain is such a broad topic as a doctor, there are some things that we need to clarify with this question. I need to know your age. Are you in your teens? Are you an adult, like in your 20s or 30s or 40s? Are you menopausal? I need to know the age range to be able to have a differential diagnosis in mind. That's number one. Number two, I need to know if for example you're in the reproductive age, I need to know if this is before your period or after your period. Okay, that's number two. Number three, when it comes to pain, there's a code in my head that has to do with sight. Now, we need to know exactly if you are sure that that site you're talking about is actually vagina and not vulva and not your lower abdomen and not, you know, your bladder. I'm going to insert a picture up there showing briefly the female reproductive system. Now you have the vulva, which is the outside part that you see. The vagina is the passage, the entry where things enter or babies come out. Then after that, you have the end. You have something at the end. You have the cervix, and then you have the uterus, which is where the menstruation blood comes from and flows down out of the vagina, or where the baby grows, or where the baby is formed. Okay. Now, if you say vaginal pain, it's sort of a broad, you know, sort of thing that you said. Now, I've spoken about sites. We're going to clarify that in the image above. You need to be sure where exactly it is. Then onset. Did this thing start suddenly or it's been building up gradually? Yeah. Then character. Is it dull? Is it sharp? Don't know. You need to tell me what sort of pain it is. Is it like menstrual pain? What sort of pain is it? Now, let's go to radiation. Does it move anywhere? To the back, to the front, to the lower part? Where does it go? Do you get what I'm saying? I need to know if this pain moves anywhere to your upper tummy, lower tummy, anywhere. Now, is there anything that makes this pain better? And is there anything that makes this pain worse? What have you used for this pain? Hmm? Now, is this pain associated with your period? Is it associated with maybe when you just had sex, like after sexual intercourse? When do you normally have this pain? If you just say at night, you said at night, yeah, but is it only just suddenly you come back from work, you're stressed, and you start having the pain at night? Is there something that triggers this pain? Do you get what I'm saying? Now, the last one would be on a scale of 1 to 10. Can you give this pain a score? Is it 1? Is it 2? Is it a 10 over 10? 10 over 10 means you're almost dying with this pain and you know you can't you can't stand this pain. It's like you're about to die. I forgot to also add, I don't know if I already spoke about it, but is there anything? Oh yeah, I think I spoke about it already. Is there anything that makes this pain better or worse? We need to know if it's just paracetamol or you have to use morphine or you have to use codeine. Like we need to know what makes this pain better. Okay. Now, there are a number of things that could cause vaginal pain. It could be a dysfunction with the muscles in the pelvic region. It just means there's a weakness there and it's causing you to have pain. It could be an infection. Yeah. It could be something associated with your period. It could be even fibroids. Now, imagine this picture that I've put up on top of my head. You can see this picture. Now, for you to have pain anywhere in this place, there must be something wrong in that area. If it's not in that area, then there's something wrong somewhere else, which could be hormonal, that's making you have certain pain or discharge or making you stressed about something. Do you get what I'm saying? So most times when we have pain, it's usually originated from somewhere. There's always a genesis from somewhere. That pain won't just appear from nowhere. Do you get what I'm saying? The pain has to come from somewhere. It could be anything. So what I'd love for you to do is, if you're in Nigeria, go to a doctor and just tell them, explain this pain to them. Now, if you're not comfortable, try to ask for a female gynecologist or ask for a female doctor. Or if they, for example, want to examine you to understand this sort of pain, or if they can elicit this pain, you can ask for a chaperone. You can tell your partner to go with you, or tell your friend, your sister, just tell someone to go with you so you're comfortable when they're examining you, okay? That is very important. Now, when you go and see the doctor, if you go in the UK, if you go and see your GP, you know how things are with the GP. You need to explain yourself. You have like about 10 minutes or max 15 minutes. That's if they give you that time, but you need to explain yourself properly so that they will give you the they will request the right investigations for you. Do you get what I'm saying? If you are extremely worried about something, you need to know how to explain how you feel. Okay? So I'm really sorry I'm unable to answer your question, but with such short question, it only limits what the diagnosis could be. And then I cannot give you a diagnosis without seeing the patient physically, requesting for necessary investigation, and then making a diagnosis with the report of those investigations. Okay? I hope I've been able to help you just break down these things, even though I'm not giving you a diagnosis yet. I wouldn't give anyone a diagnosis online if you haven't gone through the necessary steps.